We have Dr. Mary Stephen joining us live from Congo, Brazzaville. She's a technical officer at the World Health Organization Regional Office. Thank you so much, Dr. Stephen, for joining us on Arise America. Now, the world is seeing a spread in the new variant, Omicron. Can you explain what people need to know about this new variant?
Thank you for having me. Good evening. So yes, we got the report of the COVID-19 new variant first reported from South Africa on 24th of November. So initially we had two countries affected in Africa, South Africa and Botswana. The cases continue to increase globally and across Africa. So we have at least 8 countries now that are reporting the new variant. And the concerns about the new variant is because it has a very high number of mutations. But whether or not it's going to present with severe disease, evade immunity, evade the available vaccine, and even other tools that we have like the testing and the therapeutics is still not very clear. We know that it is currently dominating the infection rates in South Africa, and cases continue to increase. But the likely transmissible, but we don't know whether it is more transmissible than the Delta variant. But research continues, and we are also supporting the government with epidemiological investigation to understand better the behavior of the variants.
Now, is there any scientific reason why countries such as Nigeria and South Africa are facing travel bans? Or is it just a knee-jerk reactions from government?
So, since the beginning of this COVID-19 pandemic, countries had implemented some measures with the goal of reducing transmission of COVID-19. But all countries are also signatory to the international health regulations that aims to reduce international spread of disease without unnecessary interference with international trade or travel. So what we have seen that countries reacted to the way they reacted to with the announcement of this Delta variant. We saw lack of solidarity from the countries, especially against countries in Africa that reported this COVID-19 variant. The advice from WHO is to implement what we call risk-based approach. So instead of completely closing their borders, to assess the risks, look at the scientific information they have, epidemiological situation, both in country of departure and country of arrival, looking at the health system capacity, and expand those capacities to be able to detect these cases. They could also put in risk mitigation measures such as the testing before travel, the quarantine, instead of completely closing the borders.
Now, Dr. Stevens, let's talk a little bit about the narrative. The Omicron variant was discovered in an African country, but not an African was infected by it. Now, people are saying there's a change of narrative, and that's why many African countries are getting banned from travels. What's your reaction to this?
So what we saw from the ban in travel initially, even till today, is still focusing mainly on countries in Africa. Although some countries had implemented ban on some countries in Europe and other parts of the world, but Africa still bears the greatest brunt of these travel bans. So that is why we are calling for fairness in implementation of these measures, and also looking at the science first before we implement or just close borders, and try to apply other risk mitigation measures, meaning alternatives, rather than completely closing the borders. We have seen the devastating effect that closure of borders has caused on economy and livelihoods in general, and the economy is just beginning to come up. And now with these travel bans, we might experience some reversal in the gains already made. So that is why we continue to call on countries, apply risk-based approach. You can use alternatives like the testing and quarantine to facilitate international travel while reducing these risks of COVID-19 importation or even exportation from countries that are reporting these cases.
Now, let's talk about procedures and protocols. What should be in place to allow travel borders to remain open whilst making it as safe as possible for people?
Hello?
Dr. Stevens,
Yes, can you ask this question again, please?
let's focus on procedures and protocols now. I was asking what should be in place to allow travel borders to remain open whilst making it as safe as possible for people?
Yes, so what we are calling on countries to do, first of all, countries need to expand their capacity in terms of genomics surveillance so that they are able to detect every potential new variant early enough. They need to expand the health system capacity to be able to cope with potential increase in number of cases. So meaning that the hospitals, health workers, the supplies that we need. So that is also very, very important. They need to make sure that vaccines are available or expand vaccination coverage, especially for countries in Africa where the vaccination is very, very low. And some of the risk mitigation measures that they can put in place, like we said earlier, the testing, the issue of quarantine, and finally, compliance with public health and social measures. So we have to make sure that the general population is wearing face masks, avoiding unnecessary mass gathering, keeping your distance away from others, because the viruses move, of course, through people. So we need to implement all these comprehensive measures so that while the international travel is ongoing, we are also preparing the health system to respond and mitigating the risks of importation of the new variants.
And lastly, before I let you go, still on travel restrictions, are travel bans yet another obstacle for those people that are hesitant to have a vaccine?
Well, I don't think it is because not all countries are actually requiring countries or travelers to use vaccination as an alternative to the quarantine or the testing. So for countries and individuals, first of all, we need to expand, of course, the vaccination coverage. But people should get vaccinated not because they want to travel. They need to get vaccinated because they want to protect themselves and protect others. Because we know the vaccines are effective. We know that it reduces severe disease. So it means that it reduces admissions into the ICUs. It reduces potential death, which is very good incentive already for people to get vaccinated, whether or not they want to travel. And it also helps the health system because if people are vaccinated, they are not getting severe disease. It means that our systems will not be overwhelmed with COVID-19 cases. So both helping the response itself and helping individuals at the same time.
Finally, speaking of vaccines now, what progress has been made across the continent to administer them?
Yeah, so we have seen progress in terms of vaccination on the continent. Around June or July, there were a lot of setback when India stopped exportation of the Covishield vaccine. But now we have seen access to the vaccine improved a lot better than what we saw around June and July. So far, we have received about 375 million doses of this vaccine. We have vaccinated or administered 249 million doses already. About 107 million people have been fully vaccinated, which is about 7.8% of the population in Africa. So we are not where we want to go, but definitely where we used to be before.
Dr. Mary Stevens, Technical Officer at WHO Regional Office, Congo, Brazzaville, thank you for joining us on the news and for updating us.